let's come to our orthopedic instrument. This is our bone. Now suppose we have to insert a screw. So before that, we need to make a pilot hole. That is the initial hole before making it a drill. So this is an instrument known as drill bit. This is an instrument known as drill bit, and it consists of peculiar spiral flutes. And these are used for making the pilot hole. First, this is used to make a pilot hole anywhere where we want to insert the screw. After using this, we will insert a depth gauge. We do not have depth gauge here. We can use it after the bone tapping also, but what happens is if we use this depth gauge after bone tapping, the hook of this depth gauge will disturb drill or disturb the thread that is made by the bone tap. Now next, after measuring the depth to know the length of the screw, we will use now bone tap. Bone tap is used to make a thread in the initially made pilot hole by the drill bit. It cuts a thread so that the diameter of this is equal to the diameter of our screw used. Now let's come to the screws. So what is a screw? A screw is a mechanical device that converts our rotational force into linear motion. Or we can say it is a device that converts our torsional force into the compression force. So before talking about its function, we should know the components of the screw. This is our screw, and the components of the screw are the head. This is the thread. This is the tip. It is a cortical screw. So now this is the head. This is shaft. This is thread, and this is the tip. So the head consists of a recess. It is a slot for the screwdriver and is very specific according to the screwdriver. Below the head is a part of head. It is the countersink. It can be normal or be threaded according to the locking screw or dynamic screw. So this is our shaft. Shaft is mainly for providing the lag effect. That means the distal cortex, which are lagging, they are compressed towards the center. While we are engaging the distal part of the screw, it gets engaged in the far cortex, and this gets engaged in the near cortex. And this region, the region from where thread starts, it is always behind the fracture line. The shaft does not provide any purchase. It does not take any purchase, so there's no any resistance, but it provides resistance. And due to this, the fragment that is distal toward the fracture line, the interfragments, they are compressed towards the main fracture line, toward the proximal side of the bone, and hence compression and stability is gained. And this is our thread. Thread consists of two diameters, the thread diameter and the core diameter. The diameter between this thread is known as thread diameter, and the diameter of the core is known as core diameter. The core diameter decides our bending strength and torsional strength. The more the core diameter, the more is our bending strength, resistant to bending or torsioning. And the thread diameter, it decides our pull-out resistance, or it also decides our holding power. The more the thread diameter, the more is our holding power. And this is our tip. The tip may be simple, that is non-self-tapping, or it can have a cutting flute. It is a sharp groove that is capable of making threads in the bone. So the nails with cutting flutes are known as self-tapping because they don't need pre-tapping before inserting the screw. Now we will talk about the type of the screw. Let's talk about the cortical and cancellous screw comparatively. This is our cancellous screw and this is our cortical screw. Cancellous screw. In case of cancellous screw, the thread diameter, the diameter of the thread is comparatively larger than the thread diameter of the cortical screw. Whereas in cortical screw, the thread diameter is less and core diameter is more in comparison to the cancellous screw. Also, we can look for the thread depth. The depth between the thread and this core is known as thread depth, and thread depth is more in case of cancellous screw. It is less in case of cortical screw. The distance between two thread is known as pitch. This pitch is more in case of cancellous screw and it is very less in case of cortical screw. So these are the differences of the cortical and cancellous screw. Now we can also have locking screw. The locking screw have threads over the countersink. It has thread over the countersink and it is used in the locking compression plate. The locking screw can be cancellous, it can be cortical, or it can be cannulated, non-cannulated. Now we have a special type of screw, that is a cannulated cancellous screw. We don't have here, but cannulated cancellous screw has a cannula in between, that is for the guide wire, and it is useful in case of loose reduction percutaneous pain. Now this is an important component of the screw, this point. This is known as run out, the point where the shaft is changing toward the thread. Here the diameter changes abruptly and there is the presence of a corner. So it is the site of maximum stress concentration and there is the possibility of the breakage of the screw. Along with this, we have the screw in DHS system, dynamic heat screw system. This system has a plate and a screw. This is also a kind of screw. The name of this screw is sliding DHS screw. This is cannulated. We can see the cannula inside, and it consists of a thread. It has a shaft, and this shaft is always for the lag effect. Now let's talk about the implants. We have nails and plates mainly here.